A recent Gallup poll indicates that 51% of the American public doesn't know what is in the pending health care reform bill or doesn't understand it. A previous Gallup review of the issue showed that only about a fourth of Americans believe that members of Congress understand the issues involved in health care reform. And for good reason, since not one congressional Democrat pledged to read the bill before voting on it. Those are frightening statistics. This is our health that we are talking about. Across both sides of the political aisle, fingers are pointing and accusations are flying that the other side is trying to scare and mislead the American public to win favor for or against the latest Obamacare plan. You're lying about this, they're lying about that. It doesn't say this, it does say that, they rant at each other. Well, what exactly does it say, you might ask? I know, I did. That's why I went to the website opencongress.org to read the bill myself without spin. Well, at least without the media and politicians twisting it this way or that. Trust me, my head was spinning as I read the cumbersome, often confusing monstrosity of a bill. And as I read it, the same questions kept creeping into my head. Is this the best option for me and my family? Is this the best option for America? I know my answers. Now you decide. Here's a sampling of what the Obama administration's health care plan, H.R. 3200, currently under consideration in the House of Representatives, says. Section 123, Health Benefits Advisory Committee. There is established a private-public advisory committee, which shall be a panel of medical and other experts to be known as the Health Benefits Advisory Committee to recommend covered benefits and essential, enhanced, and premium plans. Is that a government agency determining our benefits? You decide. Section 152, Prohibiting Discrimination in Health Care. Except as otherwise explicitly permitted by this Act and by subsequent regulations consistent with this Act, all health care and related services, including insurance coverage and public health activities, covered by this Act shall be provided without regard to personal characteristics extraneous to the provision of high-quality health care or related services. Section 246, no federal payment for undocumented aliens. Nothing in this subtitle shall allow federal payments for affordability credits on behalf of individuals who are not lawfully present in the United States. Is the government going to continue to provide free health care to illegal aliens? Section 152 strongly implies yes. Section 246 says no. You decide. Section 401, Tax on Individuals Without Acceptable Health Care Coverage. Chapter 1 of the Internal Revenue Code of 1986 is amended by adding at the end of the following a new part, tax imposed. In the case of any individual who does not meet the requirements of subsection D at any time during the taxable year, there is hereby imposed a tax equal to 2.5% of the excess of the taxpayer's modified adjusted gross income for the taxable year over the amount of gross income specified in Section 6012A1 with respect to the taxpayer. Is the government going to tax us if we don't have coverage that's acceptable to some bureaucrat in Washington? You decide. Section 441, Surcharge on High-Income Individuals. The tax imposed under this section shall not be treated as a tax imposed by this chapter for purposes of determining the amount of any credit under this chapter or for purposes of Section 55. So, is the tax a tax or not a tax? You decide. I'll stop there, a mere 200 pages into the bill with just over 800 to go, to ask you whether this proposed legislation offers you and your family what you thought you'd be getting in the government plan. You decide. But remember, it's our legislators who will ultimately decide whether the plan becomes law or not. Let's hope they took the time over the August recess to read the bill and talk with their constituents. Is this the best health care reform option for America? You decide, and then tell your member of Congress and senators what you think. No one else can do it for you. That's this week's Freedom Minute.